As a physician, one of the most common questions I get in regards to autism is sleep. In our last video, we talked about how sleep difficulties in autism is remarkably common. In this video, I'm going to tell you how to screen for it. And if you watch all the way to the end of the video, I'm also going to give you information on how to know when to request a formalized sleep evaluation with a specialist. If you have a child with autism and you're concerned about sleep difficulties, you're probably right. 50 to 80% of individuals with an autism spectrum disorder have sleep-wake cycle problems. And these sleep difficulties cause problems for the child, for the school, and for the family. ADHD goes up, self-injury goes up, anxiety goes up, social communication goes down, and so does parental functioning. If you've experienced any of these difficulties and you know what I'm talking about, drop a comment below and share your story. But just because sleep difficulties are common in autism doesn't mean that your child has a sleep-wake cycle disorder. How do you know? In a recent article in the Journal of Autism and Developmental Disorders, a screening tool was derived and submitted for review that potentially answers this question and makes your life a lot easier. This tool is called the Modified DIMS, which stands for Disorders of Initiating and Maintaining Sleep. This screening tool is made up of 7 questions which I want you to understand, each of which is scored 1 through 5. Scores of 10 or less are unlikely to be consistent with the diagnosis of insomnia. Scores of 11 to 16 raise concern for the possibility of an insomnia, and scores over 17 represent a clinical diagnosis of insomnia and merit further evaluation. Question number 1, does the child go to bed reluctantly? A score of 1 means they have no problem. They walk to bed, they put themselves to sleep, no big deal. If you have a score of 1 and you're watching this video, I have a bunch of other questions for you. If you have a score of 5, that means that every night of the week is an absolute disaster. This child fights a transition to bed. Question number 2, does your child have difficulty falling asleep at night? A score of 1 means they're asleep within 30 minutes without difficulty. A score of 5 means that this is a prolonged event to initiate sleep onset, often paved in tears and sorrow. Question number 3, does the child feel anxious or afraid when falling asleep? A score of 1, they have no problems, there's no big deal. A score of 5, every night of the week, they're afraid, they're anxious, they see the clock ticking, they know the time has come, they follow the bedtime routine, and it is terrifying for them. That is a score of 5. Question number 4, the child wakes up more than twice per night. A score of 1, almost never happens. A score of 5, it's every day. Multiple times overnight, you are up putting this kid back to bed. Question number 5, after waking up overnight, the child has difficulty going back to sleep. A score of 1, they roll over, they stretch out, they go back to sleep, no problem. A score of 5, it's a knockdown, drag out fight every time. Question number 6, how many hours of sleep does your child get on average per night? As you can see here, children require different amounts of time for sleep depending on how old they are, but there's still a range. Individuals who score a 1 are sleeping between 9 and 11 hours, which, as we just looked at, is a pretty typical time frame. Individuals who score a 2 are sleeping between 8 and 9 hours per night. Individuals who score a 3 are sleeping between 7 and 8 hours per night. Individuals who score a 4 are sleeping between 5 and 7 hours per night. And lastly, individuals who score a 5 on this question are sleeping 5 hours or less. And the last question, how long after being put to bed does it take for your child to fall asleep? Less than 15 minutes? You get a score of 1. 15 to 30 minutes, you get a score of 2. 30 to 45 minutes, you get a score of 3. 45 to 60 minutes, you get a score of 4. And if it takes your child more than an hour to fall asleep every night, you get a score of 5. So how did you do? If you got a score of 10 or less, the likelihood of an undiagnosed sleep-wake cycle disorder or morbid insomnia is very, very low. If you got a score between 11 and 16, it's not clear, but you need to bring it up with your physician. You need to maybe think about further evaluations, maybe take a sleep diary, pay closer attention. And if you've got a score of 17 or higher, your child has insomnia. Now, what that consists of and what it means is a different discussion. But remember, if it's over a score of 17, your child needs an evaluation, not only with your primary care provider, but sometimes with a sleep specialist. How do you know? welcome to the bonus round. Identifying whether or not a child has concerns for insomnia is hard enough, but understanding when those concerns should lead you to evaluation with a sleep specialist, you have to answer these questions. If your child scores a 3 or higher, they need to see a sleep specialist. Each one of these questions is scored similar to the ones just discussed. Every answer is scored between 1 and 5. And remember, if you give it a score over 3, you need to see a sleep doctor. Question number 1. Does your child demonstrate any of the following? Their body startles or jerks when they're falling asleep or during sleep. Your child often changes positions. They're flopping around all night long. Your child often kicks off the covers. You come in the room every day and the covers are in the ceiling fan, in the driveway, underneath the bed, in the toilet. Your child shows repetitive actions while falling asleep, such as rocking or headbanging. If these things never happen, that's a score of 1. If they happen almost every night, that's a score of 5. Question number 2. Your child snores loudly or has difficulty breathing while asleep. If this never happens, a score of 1. If it happens every night, that's a score of 5. And lastly, does your child show any of the following? Wakes up from sleep screaming and confused. Sleepwalks. If this never happens, score of 1. If it happens every night, that's a score of 5. And remember, if your child scores a 3 or higher on any of the questions we just discussed, not only do you need to talk to your primary care provider, but that conversation needs to lead to a formalized sleep evaluation with a sleep specialist. Sleep problems and autism are unlikely to just go away. These are not things they're going to grow out of. So an evaluation is absolutely necessary. Oftentimes people want to know, what can I do right now? How do I address these behaviors? How do I make better choices? How do I make sure I'm not reinforcing these decisions? And that, my friends, is the next video.